Hello, everyone, and welcome to today's webinar. Let's see what some of the responses were. Do I see any responses? I don't in the chat about what this or that, your summer or winter or spring or fall. Mine is definitely summer and winter. I don't love spring or fall. So today's, hold on just a second, sorry, let me get my script up. Today's webinar is Got Wellbeing, Designing a Campus-Specific Wellbeing Program. This webinar will provide practical and real-world examples from Thad Mantaro's 15+ years of work in health promotion and well-being on several college campuses. The webinar will provide background information about models of college health promotion, multidimensional well-being, key approaches, and examples of programs related to stress reduction, mental health, student retention and well-being, and employee well-being. The program will provide some information about employee well-being. However, the primary purpose will be to discuss student-related programs and best practices. A few housekeeping items to go over really quick. If you have any questions during the webinar, please type them in the Q&A or chat box, and we will get to them at the end. Please connect with us using the hashtags NCCA webinar, and we will be sending a recording of this webinar to those that registered today. I'm going to give a brief introduction for our speaker. Thad Mantaro has worked for over 15 years in health promotion and well-being at 4 different institutions. He is currently Senior Manager of Partnership Engagement at Elite Research, a small statistical consulting company, and a doctoral student in higher education administration at Texas Tech. His doctoral research focuses on the leadership of well-being programs. So without further ado, I will pass it over to Thad.
Thanks, Kaylin. I want to say thank you so much for that introduction, and I really want to say how grateful I am to you and Bobby and Brian for allowing me to host this webinar today. I'm really excited to meet and talk with your members of the Missouri Community College Association. Let me put my presentation up, and let me make sure I'm all set here. Let's try again. It says try again. It's not working. Let me try again.
Is it not working for you?
Can you see my share now?
Success.
Yay, okay. Well, hi everyone. It's a little strange for me not to have an audience right in person because as a health promotion person, I'm very used to having an audience right there in front of me. I was fortunate to have a little information shared with me from Bobby and Kaylin, just giving me a general idea of who was in the audience, and I found that really helpful. I don't have your names, but I have a little sense of what kinds of positions that you represent. Today, I'm going to talk about designing a campus-specific well-being program. And as Kaylin said, that reflects my 15 or more years in higher ed. I have worked in health promotion or well-being at 4 different campuses during that time. And I'm really excited to share a little information that might help you start a program on your campus. As she mentioned, this is a little bit of my background. I won't repeat all of that, but some of the things that I wanted to tell you were that I have worked at several institutions in New York State, SUNY Oswego and Colgate University, and a couple of institutions in Texas, Texas Women's University and the University of North Texas Health Science Center. My expertise really has been in health promotion and well-being. I've also had very specific leadership roles for alcohol and other drugs, sexual violence prevention, peer education, bystander intervention, and a really strong thread throughout my work has been marketing and public relations and social norming marketing. In these latter 2 positions, I've been responsible for bringing together broad institutional well-being programs, sometimes across 5 separate colleges within an institution, and also taking on larger roles for assessment for SAMHSA. I'm a counselor by training. As Kaylin mentioned, I'm in the higher ed program at Texas Tech with your executive director, Brian Milner. And as she also mentioned, I am focusing on the leadership of well-being initiatives. My interest really is in chief wellness officers, how they function effectively in complex environments. And as you all know, colleges, universities, community colleges can be very complex environments. I'm interested in the way that distributed leadership works among all of those volunteers. So one of the things that I asked Kaylin to do to get us started was to survey the audience to see before we had the webinar what people were interested in. And I'd like to share back with you a little bit of that information. What I heard from you is that you were interested in topics like models of well-being, data-driven decision-making. In terms of specific program topics, I heard about multidimensional well-being as very important. Models included things like socio-ecological models, SAMHSA, Gallup. And when I asked specifically about wellness programs and whether or not the schools had them, there were about 120 people who replied, but at least 100 said either I prefer not to answer or no, we don't have one. And I thought that that was pretty striking. I also used this as a litmus test. I asked if there was one central office, and what I heard back were kind of characteristically the same. I don't know, we don't have a program, efforts are siloed, I'm not sure, etc. One of the things that I tried to do too to prepare was to do a quick check. I went online and I looked a little bit at the context for community colleges. I looked at your individual institutions within MCCA and looked at what you had going on. One of the things that's true for community colleges, as it is also true for all institutions, is a major concern as mental health issues continue to rise. What I saw on your websites, all 12 that I looked at, were that there was a strong emphasis on self-care, advocacy, mental health, and counseling. There was some presence for fitness and rec, sexual misconduct, Title IX, domestic violence, sexual violence prevention, and bystander intervention. And there was also a representation of the biennial review, which catalogs the different alcohol and other drug issues and responses. But, and I may have missed it, and I want to say this is a caveat right out front, there was no health promotion examples. I think that the only school that seemed to have a health promotion office was St. Louis Community College, and those were programs that seemed to be represented for the larger community through continuing ed. I thought that this was a little unusual, having worked at a couple of institutions where there were departments devoted to health promotion or other allied health concerns. It was clear to me that many of your institutions have those kinds of programming, those kinds of academic departments. It seems to me that those are a resource for those of you that may not have a health promotion office to begin to draw on for some programming opportunities. I'm having a little trouble advancing. Give me 1 second. I'm gonna try to stop the share and move on to the next slide. Bear with me, technical difficulties. Thank you for your patience. So I hope you can see that again. So the learning objectives for this presentation are for you to be able to describe definitions for health promotion, wellness, and well-being, to be able to identify tools for data-driven decision-making, differentiate between 3 model examples, and to compare and contrast types of college well-being programs. I'm going to share experiences from my background that are traditionally 4-year institutions. I recognize, and I want to say up front, I realize that this may be a little different from some of the institutions that you work at. I think it will speak to the belief that each institution can create their own unique program. So where to start? The place I really like to start is with definitions. And so a few key definitions. I really like the World Health Organization and National Wellness Institute definitions. The World Health Organization is focused on well-being as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. It is a proactive, not a disease-based definition. And the National Wellness Institute, which is the body for well-being in the United States, says that it is an internal process a conscious, self-directed, and evolving process of achieving full potential. Over the last 15 years, I've seen these terms develop and emerge into a place where wellness is now more focused on the physical dimensions, nutrition, exercise, health, and well-being is more focused on the holistic and integrative and multidimensional components. And it would be really important for me to say that health promotion, in my perspective, is the foundation of all of these efforts. We can have programs where well-being, multidimensional well-being and health promotion co-create opportunities on campus. But without a health promotion program, I think that an element of well-being is lacking. Health promotion is the process of enabling people to increase control over and to improve their health. Really, the public health folks have staked out a claim in this game. They we see a lot of masters of public health people at the well-being director role. And in higher ed, particularly, health promotion programs work to support student success by creating healthy learning environments. They're concerned with the kind of population health level. Health promotion professionals practice evidence-based prevention. They are interested in increasing protective factors and decreasing risk factors using a public health model. Well, if you're like me, one of the things that you find with well-being is that there are so many models. It's absolutely overwhelming. There's Hetler's seminal 6-dimension model. There's the SAMHSA 8-dimension model, the illness wellness continuum. You see them across the spectrum. Martin Seligman has his own PEMDAS, positive psychology model. There are nine model and 12-dimension models. And one of the things can be that it can be extremely difficult to choose from among all the models. And I'm here to tell you today, there is actually just one right perfect model for your campus. And it happens to be the exact perfect model for every campus. And if I could have a drum roll, please, I would say that that model is whatever model you and your community choose. I'm sorry for that. I hate to be facetious. I can't hear the audience groans at this time. But one of the things that I've learned over the last 15 years in 4 institutions is if you think you are going to come in as an individual and say, I am, for example, the VPSA, and we need to have a well-being program, and I've heard a lot of great things about Hetler's model, you're going to be dead in the water. You're going to shoot yourself in the foot, because like any complex environment, a well-being director functions as a consultant internally and brings together a lot of people. There is no way for me to underscore strongly enough that wellness functions in a collaboration, particularly as health promotion grows into or constructs an overlay for well-being. It's imperative to include a lot of different constituencies, including student health services and counseling. If you move that more broadly to a multidimensional perspective, engaging your sustainability director, your fitness center director, your academic affairs folks. So it really is incumbent upon any school thinking about developing a health promotion office or a well-being program to really start from an engagement and a collaboration perspective. And as we all know, and I'm going to loop around to this several times in this discussion and this webinar, mental health concerns are just really were an issue for community colleges before the pandemic, and it just has exploded. The Healthy Minds Network, a national body, did a survey in the fall, and you might have seen that they released the results in the last week or so. They surveyed 33,000 students at 36 different colleges and universities, and almost a half of the students in the fall alone screened positive for clinically significant symptoms of depression or anxiety. About 83% reported that their mental health had been negatively impacted by had impacted their academic performance in the last month. It is its own form of pandemic or epidemic, and it's something that we really need to try and address. So to segue into data-driven decision-making as the second pillar for where we should start, I think that what I would want to share with you is that I have historically made, in every director level role that I've held, decisions based upon data collection within the institution. If you're an institution that doesn't have a lot of surveys that you conduct institutionally related to this, I would want to encourage you and say that I'm sure that within your institution, you're obviously collecting some data. If you have a counseling center, you're collecting data on how students present to the counseling center, what they're presenting with. If you have a student health services office, you have a range of issues that students are presenting with. So you have some anecdotal data. You probably also have several offices, as it seems from the feedback that I received, that are distributed that may also be collecting this information, disability services or other student affairs offices. So thinking about that, what I would really encourage you to think about is, can you make a first step towards collecting institutional data? And this is where I would encourage you to start. The most foundational tool that I've found for this, and you may be familiar with it, is the National Collegiate Health Assessment. It is a tool that is provided by the American College Health Association. I'll talk more about that in just a second. There is also something called the Core Institute Alcohol and Other Drug Survey. And I'm also a fan of educational third-party tools. I was fortunate to work at several institutions where we had enough of a budget to pursue using some of these. For example, EverFi is one company that provides onboarding products or onboarding modules for alcohol, called Alcohol EDU, and a sexual violence prevention tool that was called Haven. They have in the last year developed new tools, new modules related to diversity, equity, and inclusion and mental well-being for students. This isn't meant to be a pitch for them, but in addition to all of the exit survey data that I would collect from our programs at my institutions and institutional surveys, I would also collect data from these third-party tools. Well, let me talk to you for a second about the American College Health Association. If you're not familiar with it, this is the largest national body that integrates professionals from across several different areas, including student health services, health promotion, counseling. They've been around for 100 years. They have hundreds of students that participate. And some of the data that we collect from that really can help form the foundation for our programs on our campuses. They also provide standards for the practice of health promotion. So if you don't have a health promotion office and you are thinking, wow, it really is time we got in the game and developed a program, they give you some pretty clear guidelines for budget, for the number of professionals you need, the roles those people play, their training requirements in these standards of practice. So if you haven't seen this, I really encourage you to look for that. The NCHA provides data, and this data is from the fall 2020 reference group. This is a little bit of an outlier. I thought twice about changing this. It was very typical when I was collecting this data in a director role that we would see an executive summary and survey data for the reference group from 30,000 students across the nation. They would typically have response rates in the 20% range. This fall 2020 reference group was slightly smaller, I think, obviously because fewer students were in residence, or it was a more impactful time and it was more difficult to collect the data. The NCHA, if you haven't seen it, collects data across all of these different categories: general health, nutrition, healthcare utilization, impediments to academic performance, violence, interpersonal violence, AOD, sexual behaviors, etc. And each survey provides information back to you about your demographic characteristics for your students, including age, gender, gender identity, first gen, different characteristics that might contribute to difficulty with academics, athletics, Greek life, etc. It gives a very good background for understanding the specific indicated and selected populations on your campus. Additionally, in the last year, and this is also not meant to be a promo for NCHA, I just think it's an extremely good tool. They have developed skip logic that allows an independent path for each student, mixing up mental health and physical health questions to reduce the stigma associated with mental health, including new language and gender identity terms to promote inclusivity. They've embedded a couple of different validated scales that I'll talk about in a little bit, and questions related to food insecurity, homelessness, sleep, which are characteristics and concerns that are emerging across our nation. It also gives information about utilization of services on and off campus for mental health, physical health, and gynecological services. Let's look at an example. For mental health, it gives a couple of scales, a number of these. And in this instance, it's looking at psychological distress. What you can see is that roughly 22% of all students that responded to the survey said that they had some kind of serious psychological distress. And also about half of the students in the survey across the nation said that they were scoring positive for loneliness. We know that this is a huge issue for this generation and for our students, that there's this pervasive sense of loneliness. And how we would use this is to begin to direct some of our prevention outreach programs and other kinds of social connections for our students. Looking at things like psychological well-being, flourishing, resiliency, you can see that also pretty significantly, most students were reflecting pretty high levels of psychological well-being despite the difficulties. And in fact, there was a median level of resilience that was 6 out of 8. Finally, they give you some good information about several kinds of impacts: procrastination, family issues, finances, the death of a family member, sexual harassment. And they qualify these in the right-hand side by the relative distress that that caused for the individual who experienced it. So in other words, about 23.5% of students experienced a death during that last 12 months. But for those students who experienced it, 3/4 of them found it to be the cause of moderate or very high distress. For those who experience sexual harassment, 7 to 8%, any sexual harassment is obviously a terrible thing. At least half of them said that it was extremely impactful. I think that we can use this to begin to also get a sense of our community, our students. This might be a little different for, say, a community college versus a private college, where finances may provoke an even greater level of distress than at a private liberal arts institution. What you can also see here is that roughly 70% of students reported experiencing at least 3 or more of these any time in the last year. Let's look at nutrition for a second. I like this spotlight on sugar sweetened beverages. This asks if students have engaged or used a sugar sweetened beverage anytime in the last 7 days. And what you can see for row 2 is that most students, 2/3 of them, said that on average they drank 1 or more sugar sweetened beverages per day in the last 7 days. It's also looking at the levels of fruit and vegetable servings. It's looking at the level of energy drinks. This gives some great information for those of you who are familiar with the math associated with this. If you or I or our students exceed our resting metabolic basal rate of calories in and calories out by 1 sugar sweetened beverage per day, on average over a year, that accrues to about 20 pounds. It's a significant impact on our health and well-being. This gives a nice snapshot of where students are in terms of their nutrition. It looks at physical activity, aerobic activity, strength training. Fortunately, you can see that almost 2/3 of students were actually getting enough aerobic activity, but in order to be considered active adults integrating the strength training components, only about 1/3 were. And finally, of, I think, particular importance to schools like the one I worked at here in Texas, Texas Women's University, or community colleges, food insecurity is a burgeoning issue. About 1/3 or more of all students surveyed said that they had either low or very low food security, which means that they were food insecure. I hope that gives a nice initial snapshot, just an initial sense of how this information is provided and how it can be used. Let me then lead into a conversation of some models. I told you that I would talk a little bit about this. This is going to be a very general introduction into some foundational models that we use in higher ed and health promotion and well-being. It's only meant to be kind of a superficial review of these, and then I'll lead into discussing some of my experiences and how this linked to some of these models. So the first model, the socio-ecological model, is the foundational model for prevention and public health. The American College Health Association uses it. It's kind of a nesting doll model. It looks at these different layers of prevention and programming impact. It looks at initially intrapersonal factors, changes in knowledge, attitudes, behaviors, and skills. We would think about targeting programs to those indicated those specific individuals. We then might think about how interpersonal processes or groups might be engaged through prevention on our campuses. We would think about social networks and families and groups and fraternities and sororities, for example, or groups like veterans that maybe are unique, or Hispanic students at your institutions who may have different needs. We might then look at institutional factors. At Colgate, we were a small private liberal arts college that was rural with a Greek population and a heavy athletic group. So then we found that alcohol and substance abuse concerns were significant, sexual violence prevention concerns were significant. So we might look at that from an institutional lens and devise large committees that try to address those factors. We might look at the dynamics between the community and town gown. Here in Denton, we have a large institution, University of North Texas, and a very large kind of college town area where there are lots of bars. We might look at the relationship with those bar owners and try to think about how we might impact community prevention models. And then we might carry that forward to public policy in terms of our state and local policies. For Gallup, they use something called the Wellbeing Assessment. They're a large consulting company, and they distributed this assessment across 150 countries. They looked for universals across cultures. And what they found was that there were 5 essential elements for well-being. And those boiled down to these 5 areas: career, social, financial, physical, and community. They found when they looked at people across all these different cultures that people were only 7% of people reported thriving across all of these areas. This can then be kind of a thematic foundation for development of a well-being program that's focused on these different themes, with program developed around these different areas. I have seen this mostly used connected with employee well-being and employee engagement. I do know of a couple of programs. One is in the Northeast, I think it's Emerson College, and they pair this with a kind of a foundational health promotion office and also a large strengths-based student affairs program that is cross-institutional. Finally, a third model is the SAMHSA model. It's built on Swarbrick's A Wellness Approach article. This is an 8-dimension model. We use this at Colgate. I'll tell you a little bit more about that in a moment. It is a model that has these different dimensions, and key to this model is trying to program across all of the dimensions and help students to understand that there is that having a holistic sense of well-being creates a well-balanced life. If you, for example, have a strong, tremendous social network as a student or as an adult, but your emotional relationships are shallow, or you have a disrupted family life or financial difficulties, your life really is not in balance and you can't fully thrive. In order to have a life that's in balance, we really need to have elements of all of these in our life. Well, that's about halfway through, and I want to now move into sharing some program examples. I'm going to talk to you about 3 of the institutions that I worked at. I'm going to share a little bit about the context for these programs and editorialize just a little bit as I go through it. I am putting off talking about the University of North Texas Health Science Center because it's a graduate-only institution focused on health. Health context. It had a College of Osteopathic Medicine, Pharmacy, Public Health, Health Professions, Graduate School of Biomedical Sciences. I think that may have some relevance to your institutions and your allied health programs, but I think for now it's too much of an outlier. So I'm going to focus just on these 3 to begin. Well, after I got my master's degree, I worked for about 5 years in a clinical setting in a community-based substance abuse clinic. And I saw a lot of students from SUNY Oswego. This is a State University of New York college on the shore of Lake Ontario. And I moved from that role to working in health promotion at SUNY Oswego. We had a wonderful, diverse program. SUNY Oswego has about 9,000 students in mostly undergraduate programs, split about half residential, half living off campus. Our student program is a peer education program, and it was a great, well-recognized, award-winning program that had been at the college since the late 80s or early 90s. We regularly trained our students in certified peer educator training through NASPA. This program was something that students who were often health promotion majors could get academic credit for. They could take it for 2 semesters. So our recruitment efforts were bolstered by that fact. We had had a historically long-standing emphasis on a range of health promotion topics that our peer educators worked on. But a key area for us, for some reason, I think because one of the assistant directors historically had been really knowledgeable and became a national expert, Michael McNeil, who is now still at Columbia, I think, developed this really wonderful area. And we would do a lot of outreach on sexual and reproductive health. This office was configured so that the health promotion office was in the same building. Only offices that were in that building were counseling, health promotion, and student health services. Family planning, a community-based agency, came into the building for that and collaborated with our sexperts. Also, we had 2 off-campus community-based substance abuse clinical providers come onto campus to provide alcohol and other drug counseling because we had hundreds of students who were responsible for violations or found responsible of the code of conduct. SUNY Oswego had a significant alcohol and other drug concern. I was responsible for that program and also for all of the social norming marketing. We had a great program to go back for a second to sexual health. We would do free condom Fridays. We would deliver condoms to people's mailboxes. We would provide condoms in vending machines at a really affordable rate, so they were available to students at any time in their residence halls. We had a great collaboration with the counseling center that was just across the way. We partnered on mental health and stress reduction programs. We did bystander intervention training for sexual assault, depression, AOD, hazing, and dating violence. And there was a very, very strong program for safe zone training, allyship, talking about the differences between sexual orientation, gender identity, and gender expression. It really became something that was a hallmark of our campus. And this is a snapshot of the building. Sometimes I really regret having left this position many years ago because my office looked out onto the lake. I could go out there in the summertime. It was really a beautiful place to work. From there, I was hired as the inaugural director of the Shaw Wellness Institute at Colgate. And I'm going to share some information that I think is a little less relevant for your institutions. Again, as I've said, I think it really helps to show you how differently institutions can configure their programs. The Shaw Wellness Institute is a institute for well-being and health promotion at a university where, for example, and I'm imagining that your jaw's about to hit the floor, 60% of students are full pay at $50,000 to $60,000 a year. That's changing. I think they're diversifying the socioeconomic background of students, but it was a very prestigious, very high SES environment. One of the things that was true about this space was it was kind of the living room for health promotion, for counseling, and for student health services. We weren't in the same building. The Shaw Wellness Institute was in a residential space on what we like to call affectionately the garden level. We were about a football field away from the fitness center, student health services, the chaplaincy, and the counseling center, respectively. And we worked very closely with those offices and many others. We used a multidimensional model, the 8 dimension of well-being. And for example, I partnered every semester with the Office of Sustainability and the Director of Sustainability to offer an environmental well-being program. We obviously partnered extensively with the Counseling Center on Emotional Well-being, the Office of Student Engagement for Social Well-being, different academic departments, the chaplaincy for programs, the Fitness Center extensively. And we had if I didn't mention it already, I think I might have, but we had a very large endowment that allowed us to do a number of programs and provide sponsorship to some of those other offices. We functioned in a sense by having a core of health promotion like SUNY Oswego, but for only about 2,000 students. And what was unique about Colgate, we had so many issues with eating disorders and disordered eating that we had an eating issues management team. Restriction was the concern at Colgate versus over consumption of calories. We had a full-time dietitian. We had a full-time alcohol and other drug service provider because there were also hundreds of students who were referred for violations of the code of conduct. We had a full-time counselor that met with them, did programs with Greek life and athletics, etc. And we, as a result, also had a pretty substantial bystander intervention program. Our program was almost entirely student-led. This program trained every single new student that came to campus every year for the 3 years that I was supervising it. We trained 750 students a year. They then also trained every Greek member every year, kind of as a repeat measure. As I was leaving, the new director came in and brought together all of our different student groups, and we had 5 or 6 at that time, a peer educator group, an active minds group, consolidated that all into a wellness ambassador program. And I told folks that I would mention 2 programs that were related to mental health and stress reduction. 2 of the things that I was most proud of when I was there was I was trained in something called MBSR, mindfulness-based stress reduction, based on the work of John Kabat-Zinn. I ran this program with students. It's an 8-week program in conjunction with the counseling center. We were able to show statistically significant reductions in stress as a result of participating, both, I think, at the end of the program, then the counseling center followed up 6 months later. We had also a national chapter of the Active Minds groups. This is a group that aims to reduce stigma associated with mental health and mental illness. This group did tremendous things in terms of direct outreach focused exclusively on mental health. And I made a note to mention here that during the time that I was at Colgate, I focused on getting to know other chief wellness officers and directors. And one of the relationships that I developed with the chief wellness officer, who's now at Oklahoma State, Thad Mantaro. Todd does a lot of work looking at very carefully tracking all of the attendance at these different programs. And he's able to show, and has presented a few times, on how the level of engagement by students, and this might have some pretty strong relevancy for community colleges, how the level of attendance is directly, he can show a correlation to student retention. I can share more information about that later if you'd like. Finally, Texas Women's University is the largest university predominantly for women in the country. As the name suggests, I was hired as the finalist in a national search. You might be familiar with Keeling and Associates. I was really, really proud and excited to be selected for that role. Texas Women's University obviously is very focused on the health and well-being of women students. About 10% are men, mostly in graduate programs. There were 3 campuses, Denton, Dallas, and Houston. And so as you can imagine, there were challenges trying to program and coordinate well-being efforts across those different campuses. Both here at Texas Women's and at Colgate, I was responsible for employee wellness programs. We integrated that as part of the program in well-being, and we also integrated, I supervised the health promotion coordinator as a kind of foundational element, because we had women who were predominantly low SES, very diverse, tied for the 5th most diverse school in the country, Hispanic serving institution, high numbers of veterans. We really focused on the role that women play in their families and in their world. We looked to try and train them to be advocates who can improve their communities, linking self-care to career development, educating the whole person, and focusing on the role that women play within their families for finances, nutrition, and well-being. We then decided, as the result of an extensive strategic planning process and listening tour that I implemented, that a traditional health promotion theme or approach for our larger well-being initiative was not the right way to go. I came onto campus and I shared with, met with 120 different people, department chairs, deans, other rank and file folks, talked with them about what the campus would want, held a strategic planning session and retreat over several days, shared with them best practices, and one emerged and bubbled to the top. UCLA uses a model of collective impact. It's a community-based grassroots effort that allows a community to enhance its efforts. And In that, it used a hub and spokes model where there's a backbone organization. People like the idea of the wellness office serving as the backbone of a distributed model, that coordinating our efforts, catalyzing and communicating our efforts. And so we devised these 5 themes: the built environment, nutrition, mental health, movement, and financial well-being. I hired 2 staff or faculty or one of each members to chair those committees and to recruit other faculty and staff members and students to the committee. We had 1 graduate assistant for each committee and developed a number of unique programs for that across campus. It was very important that we communicate from a narrative perspective in this culture. This is Najwa. She was one of our graduate assistants for the movement dimension. Self-care was always very strongly emphasized as part of the culture of this thematic well-being approach. And as I was leaving, I was fostering the embedding of a co-curricular framework, development of an online resource library, an assessment that could be used pre-post. We were able to construct within a Canvas shell information and a variety of formats of information that could be embedded by faculty into coursework, syllabi, or their own Canvas shells. We worked with our student life division to use an anthology, formerly Campus Labs tool, the Pioneer Engage platform, to create kind of like an e-portfolio where students could engage with the wellness initiative and track their own personal and professional development and earn a badge. So that was, an example of how a thematic approach really connected best at this kind of a university. Additionally, across all of the campuses, as I mentioned, I supported and sometimes directly led bi-monthly or monthly well-being programming for faculty and staff. We would at Colgate host monthly sessions, bringing speakers. We would provide lunch for them. I worked very closely with human resources to implement health risk assessments and biometric screenings through a third-party vendor that we brought to campus. There were free gym memberships at Colgate or reduced prices at other campuses. And often that vendor provided specific employee programs like wellness coaching, nutrition and fitness trackers, online educational resources. Every campus, kind of as a standard, now has an employee assistance program, and we always partnered on the wellness and benefits fair as a means of promoting employee well-being. Well, that is, I imagine that felt a little bit like drinking out of a fire hose. I apologize if it was a lot of information. I wanted to really try to touch on everything that you asked about. A summary of really what I think about developing a well-being program or health promotion program. Obviously, there's a lot of models. Choosing the right model for your college should always be a collaborative process. I can't say enough about investing enough time to determine what people will really commit to. It really requires a dedicated budget and staff, even if that just means it's a half-time person under student health services. And looping back to the beginning, I think that everyone would agree that rising mental health concerns and other issues for all institutions, and particularly community colleges, require this type of integrated approach. In terms of recommendations, I'd say start with the data that you have. Really, I think that there are a few VPSAs or other senior staff members on this webinar today. If you're not a VPSA, bring that information to your VPSA and say, here's what we have. Could we, for example, conduct a survey like the NCHA as a pilot and see what information we get? One of the prompts that I hope won't burden Kaylin or Brian or the MCCA in any ways, you might consider, as the representatives on this webinar or as a association, reaching out to the ACHA and seeing if they'd offer a pricing discount for all of you that maybe don't already participate, or if nobody does, as a means of bolstering larger volume engagement. Part of what a benefit there would be that you can ask them for an aggregate report, and you can see how all of the community college health and well-being responses are representative of your students within Missouri. You could use those results to then define what type of needs your college has. If you already have a health promotion office, explore the value of kind of overlaying a multidimensional well-being program. Certainly one of the things that you can do that I would recommend, since I see a number of you have allied health, is think about tapping your faculty to provide programming that you could use to bolster this sense of multidimensional well-being on campus if there's nothing already. Try to break down silos and collaborate across distances. Obviously today we're doing this using Zoom. The pandemic has made this slightly more easy. One idea that you could use for your association is that each campus might take a topic across all 8 dimensions and or a 12 dimension model, and then have a monthly MCCA program where one campus brings an off-the-shelf well-being program to the association. And definitely attend national conferences to gain ideas. I want to say thank you to you all, and thank you to Kaylin, Bobby, and Brian for this chance to present. I'm happy to answer any questions with the time that we have left. I hope that I'll be able to answer them. If not, I would be happy to give you my contact information and have you reach out to me at any time.
Thank you so much,
Thank
Thad.
you.
And yeah, we urge anyone that has questions to please type them in the chat. I see Brian is on and he says, Thad, thank you so much for sharing your wisdom with us. Yes, of course, thank you. It's been a pleasure to work with you too, if I say so myself. You've been great to work with, very thoughtful, very thorough, which always makes the process so much easier. I actually have a quick question for you. I think with some of our schools, you mentioned budget and staffing. If they don't really have a big budget or a dedicated person to put in this position, is there anything you can recommend on how they can get started, maybe with limited budget and personnel?
Yeah, I could imagine very easily that there are folks, most campuses are going to have someone or maybe a handful, a couple of people who are in student health services or counseling. Maybe you could see if you could carve out a portion of one person's time to do that. Additionally, don't undervalue students, especially if there are allied health students. You can tap into some of them and train, reach out to other folks to train them, and then maybe have them doing some outreach. You want to be really careful about that, obviously, because you want them to be well trained. But if you have, for example, a nursing program at your school, I would imagine that some of your nurses or nursing, academic nursing professionals are folks who maybe even often have a specialization in mental health. There are, dedicated folks who prescribe just for that as nurse practitioners. So really think about all the resources you have on hand.
And Beverly has a question for you. What are the national organizations again?
Yeah, so I see that. I would say the first and foremost is the American College Health Association, or the
I'm typing this out for her.
American Public Health Association are places to start. NASPA, the National Association of Student Affairs Professionals, or the ACPA, American College Professional Association. Both of those have subgroups that focus on health promotion and well-being.
Great, thank you very much. And Beverly, I wrote some down too in notes as he was speaking, so I'll try to connect with you later on today to send you what I wrote down. Thank you very much. I really appreciate that, and I was glued in the whole time. I think I've shared with you my love for well-being and health, so I found this very interesting. And thank you to Brian for connecting me with him so that we could get this off the ground for people. I think it's more important than ever right now as well for people to, and I think they're kind of taking 2021 as the year for themselves to get themselves positioned better in a health and well-being position. Wouldn't you agree?
I do.
2021 is the year for everyone to focus on themselves.
Everybody's trying to bounce back and have a good year. Hopefully that will be the case.
Well, if anyone has any questions, please type them in. I'm going to go ahead and start wrapping things up. But if I see a question, I'll cut to it. Tony said, really enjoyed the presentation, Thad. So I echo that.
Tony.
I do want to announce some upcoming events that we have planned. Be sure to register for our webinar next week with Dr. Omid Batuhi. He will talk about student and faculty success. We will also have on that day a happy hour. We've been rolling out a series of happy hours with a dedicated topic. And next week's topic, also on March 18th, will revolve around faculty burnout. On March 25th, in honor of Women's History Month, we will have a Women Supporting Women panel with the female community college presidents and chancellors. We're really excited about that. The call for proposals and nominations for convention are open until April 2nd, so please get these into us soon. And you can check out our website for more upcoming events and information. And isn't that a gorgeous graphic Bobby made? I'm always impressed with the things he does for these webinars for us. We will be sending a recording of today's webinar to everyone that registered via email, so please stay tuned. And again, you can share today's experience on social using the hashtag NCHA webinar. I will be sharing a picture today using that hashtag because I had to hide away in my closet today to be with you guys today to escape pod life, and my husband also had a work call. So I don't see any more questions or thanks for this opportunity, Brian. Thank you all for attending. Thank you, Thad. I want to thank you all for joining us, and a huge thanks again to Thad. I'm glad him and Brian connected so that we were able to share this webinar with everyone. I hope you have a great day, and I hope to see you next week in our webinar.